Hi, my name is Emily and I am an RN in an emergency department. I'm going to be demonstrating the NIH Stroke Scale Assessment. That is an assessment that can be used pre-hospital in the ER or in any inpatient setting when somebody is having signs and symptoms of a stroke. It gives a score, and based on that score it shows the severity of the stroke symptoms. The higher the score, the worse the stroke symptoms. So we're going to begin with our patient Lauren, and I'm going to demonstrate each step. So the first thing that we're going to assess is level of consciousness. Lauren has been talking to us. She is alert. She isn't falling asleep. She isn't droopy in bed, so she would receive a 0. 1 would be drowsiness, a 2 would be stuporous, and 3 would be if she is in a coma. The next are going to be level of consciousness questions. Lauren, what month is it?
It is November.
How old are you?
I'm 23 years old.
So Lauren got both questions correctly, so she would receive a 0. If she answered one incorrect, she'd get a 1. If she answered both incorrect, she would get a 2. The next are the level of consciousness commands. I'm going to have you open and then close your eyes. Lauren, I'm going to have you hold out your hand and make a fist, and then open it again. So Lauren obeyed both of those commands correctly, so she receives a 0. If she had one that she did not obey, she'd get a 1. And if she did not obey either, she would get a 2. Best gaze is the next thing that we're going to be assessing. I'm going to have you follow my fingers. Okay, so Lauren was able to follow my fingers. Her eyes followed as I pointed. They did not fall to one side or remain in a straight direction, so she would get a 0. If one side was stuck to a certain view, she'd get a 1, and if both eyes forced to one side, she'd get a 2. The next is going to be visual fields. She is going to let me know how many numbers she sees.
2, 4, 4, 5, 2.
Okay, so in the fields, Lauren was able to identify the number that I held up, so she would receive a 0. If there were some parts that she could not see, she'd receive a 1. If she couldn't see it at all, she'd receive a 2. And if she was blind, she would get a 3. The next is going to be facial paresis. Go ahead and smile for me and show your teeth. You can see that her smile is equal on both sides. Go ahead and raise your eyebrows and then squeeze your eyes shut real tight. So she would receive a 0 because her face is symmetrical. If one part of that was a little bit droopy, like her eye or her mouth or her eyebrow, then she'd get a 1 because that's minor. If that whole side was starting to droop when she did it, she'd get a 2. And if that whole side did not move at all, she'd get a 3 because that's complete. We're going to demonstrate the arms, the motor skills of the arms. Go ahead and hold your left arm up. So what we do is have them hold it up for 10 seconds. And at the end of 10 seconds, if it does not drift, she will receive a 0. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. She would get a 1 if her arm starts to drift during that 10 seconds. Go ahead and demonstrate that. If by the end of that 10 seconds, if it ends up falling to the bed, she would get a 2. And for a 3, if when I hold her arm up, if she can't resist it at all, if it falls directly to the bed, she'd get a 3. A 4 is if she can't even move her fingers, but a 3 is if she can still move her fingers and it falls to the bed. And then it is going to be an X, unstageable, if she does not have that arm or if it's a fused joint. So you're going to do that for the right arm as well and score that side. Then you're going to go to the legs and you hold those up for 5 seconds. So go hold them 5 for 5 seconds. 5, 4, 3, 2, 1. So her leg did not drift, so she would receive a 0. If it could not resist gravity and fell to the bottom of if it fell to the bed by the end of the 5 seconds, she'd get a 2. And if when I hold her leg up, if it immediately falls to the bed and it cannot resist gravity, that would be a 3. But if she can still, as long as she can still move her toes, that's a 3. And if she can't move her toes at all, that's a 4. And if she does not have that limb, it is an X. It is unstageable. You're going to do that for the right side as well and stage it. The next is limb ataxia. I'm going to have you follow my finger, touch your nose to my finger as I move it. And go ahead with the other arm. Okay. So Lauren was able to make contact each time with both arms, so she would receive a 0. We're also going to have you demonstrate limb ataxia with the legs. So you're going to go ahead and run that heel up and down from your knee to your ankle. If she's able to do that successfully and stay on her shin, she would receive a 0. And you got to do it with the other side as well. If it is present, if she is not able to do it with one limb, she would receive a 1. If it is present in 2 limbs or more, she would receive a 2. And it was not present in any limbs for her, so she receives a 0. The next, we're going to test for sensory. Go ahead and let me know if the pinprick feels the same or if it feels stronger on one side.
It feels the same. It feels the same. It feels the same. It feels the same.
Okay, so it felt the same for her on each side and each section of her body, so she would receive a 0. If there's one limb or 2 limbs that it feels a little stronger on one side in, then it would be a 1. And if she couldn't feel the pinprick at all, she would receive a 2. We're going to assess the language this time. First, we're going to use items to see if she can describe a picture and name items. So go ahead and name these items for me.
Glove, key, cactus, chair, feather, hammock.
Alrighty. Describe what's going on in this picture.
A boy is climbing up to get to the cookie jar and is falling off a stool. The mom is doing the dishes and the sink is overflowing.
Alrighty. And then we're going to go ahead and do the sentences as well. Go ahead and read those for me.
You know how, down to earth, I got home from work, near the table in the dining room. They heard him speak on the radio last night. Mama, tip-top, 50-50, thanks, Huckleberry, baseball player.
Alright. So, Lauren was able to describe all of the objects in the picture. She was also able to describe the scenery on both sides because there's 2 different things happening in it. And then she clearly stated the words and the phrases. So she would receive a 0 for that. If she did have some slurring of words that's mild to moderate, but you can still understand what she's saying, she'd receive a 1. If you couldn't really understand what she's saying at all, she would receive a 2. And if she is intubated or she's usually mute, you can't stage it, so that'd just be an X. So as you can see, she's noticing both parts of her body. She's not just focused on the left or the right, specifically with the picture. She can see both sides of it, so there's no inattention or extinction. So she would receive a 0 because there's no neglect. If she could only see one side, then that would be a 1 because it would be partial neglect. And if she can't really see either side what's going on, it would be a 2, complete neglect. So the NIH stroke scale is something that you're going to do after they get back from CAT scan to rule out whether it's a bleed, which would be a hemorrhagic stroke, or if it's an ischemic stroke, which would be a block. You're also going to continue with more neuro exams because the stroke scale does not test pupil response or strength. You're also going to make sure you get their weight to see in case they would need TPA because that's based on weight. You're going to get an EKG and you're going to check blood work, specifically the clotting factors. That'll lead you to if it's a bleed. If the 1 level is too high, it means it's not clotting appropriately and you could be bleeding into the brain. Because a stroke is a decreased perfusion as well as a lack of oxygen to the brain. And like I said, that can be caused by a blockage or bleed. And that's it for our assessment.